Where you have read this premature death? You send me this on our WhatsApp group, because premature death, whether it is in young children's or what it is, that we have to see. Normally premature means early death, we call it as a premature death. So it may be for some cells, it can be there. It can be for the whole organism, it can be there. Whole like infant is dying, it may be premature. So it can be used in various contexts. Accordingly, we have to see the context. See now, actually we have done it up to this last time. I introduced you what it is. So this is how the thing is there. Whenever as angina is occurring, angina is because of this problem, that is we call as a demand and supply. So usually because of the heart rate, I told you all these things you learned before, so that it will help you. So heart rate, increase in the heart rate, that increases oxygen demand. Increase in contractility decreases oxygen demand. There is increase in preload, that causes increase in oxygen demand, and afterload causes decreasing. Okay, increase in afterload causes increase in oxygen demand. All are proportional. So for that, what are the drugs which can use? We have beta blockers, calcium channel blockers can act on heart rate and contractility. You know what are the effects. Then other drugs which are there, that is organic nitrate and calcium channel blockers, they can impact on preload, afterload, and thus can decrease the oxygen supply. Thus they can decrease the oxygen demand, So thus they can decrease the oxygen demand. Then the oxygen supply, why oxygen supply is there? What is responsible for oxygen supply? That is coronary blood flow and regional myocardial blood flow. That will depend on the coronary arteries. So these coronary arteries, they will be dilated using some vasodilator, including some calcium channel blocker. Now vasodilator, nitrate are also vasodilators. That means nitrates are having both activity. They can increase supply, can decrease demand. Same is the case of some of the calcium channel blocker, can do both things. Okay, they can increase supply and regional myocardial flow. How they can improve? That is some of the statins or antithrombotic when there is a plaque formation is there. So this is very simple format of angina, very easy to understand angina. That is, angina is first very important thing. It is because of the imbalance between demand and supply. Okay, so here it is balance. Oxygen is equal to oxygen demand is equal to oxygen supply. There is no problem. It is a balanced one. Okay, but when oxygen demand increases than that of oxygen supply, then it is a ischemia, and this ischemia causes pain. This is very simple, very easy situation to understand. Now, why oxygen demand can increase? Because of this increase in heart rate, contractility, preload, afterload. Why supply can decrease? Because of the obstruction in coronary blood flow or obstruction in regional myocardial blood flow. Okay, so these are the things. Now the gap is, if the gap is more, the more dangerous is the angina. If the gap is lesser, then that angina, will call it as a stable angina, that is only happening because of the exercises. Okay, so this is how easily, simply you can describe angina. This much is understood. I have seen your answers about preload and afterload, and then my next question was there, that is, what will be the impact? Now we understand what is the preload, what is the afterload. Now the drugs will acting at various level, and they can changing the preload and afterload. Okay, once we understand what is preload, once we understand what is afterload, then everywhere in this it will be used. And it is a simple physiology term which is you might have studied earlier. Therefore I ask you, and if yesterday I forced you to put it on WhatsApp, therefore you have put, but if you can make this habit, read the topics before. I have already given you the list that before angina what you should read, before next topic what should you read. Rather you should start discussion in the group that after angina is finished, then next topic will be this, and we are reading so these things. So this will be easy for everyone. Those who are not studying, at least they will also be motivated to study. that yes, we should have studied or we should do it. Unfortunately, I am not able to see this in yesterday, therefore I had to force you that you write it on WhatsApp group. Okay, I am very sure those who have read, those who have tried to understood, it will be helping them a lot. Now what are the drugs? Now from this picture, from this classification, how many drugs we are able to see? Beta blocker, do you know them? Yes, because we have studied beta blocker in detail, isn't it? Then how beta blockers will be helping? We have seen various mechanism of beta blocker. Beta blockers are doing many activities. One thing is, when they are blocking beta 1, because of that it causes decrease in heart rate and decrease in force of contraction. That means what? They are decreasing the oxygen demand, is first thing. Second thing is, they are acting through renin-angiotensin mechanism. Okay, you have to just recall all this. Because of renin-angiotensin, what we have seen is they are decreasing the sodium load is decreased. Therefore, sodium mediated actions including osmotic pressure and the sodium channel work, that is reduced. That helps in both many ways. It decreases the contractility force, it decreases, and this is another thing by which it decreases the demand. Okay, and another thing is, it causes what? Decrease in the blood volume decrease. That means what is decrease? Afterload is decrease. Okay, even preload is decrease. Then because of all these actions, what it is making is that will reducing the load on the heart, and thus it is helpful. Okay, now beta blocker, as I told you, we have studied it in very detail. We have seen in earlier, when we have completed beta blockers, how these beta blockers are helping. Okay, so I will not cover beta blocker again. Same is the case with the calcium channel. We'll just go through calcium channel blocker in brief again. Okay, then next things are the drugs which are most important in that cases are the organic nitrates. Okay, almost 150 years before the drugs were found, it was found that it causes vasodilation, and then these drugs are still in use. And earlier it was believed, or earlier pharmacology books were writing that yes, these drugs are nitrates are there, they are very good vasodilators. The mechanism is very clear. These nitrates are metabolized into free nitric oxide, which is a free radical. This free radical enters and it causes activation of guanyl cyclase, and because of this guanyl cyclase activation, cyclic GMP is formed. Because of this cyclic GMP, these activities are there, and because of that it acts on the this muscle tone, on various smooth muscle. That is, it acts on the whatsoever contractile machinery of skeleton, these smooth muscles. That is actin, myosin, calcium, on that it acts, and thus it causes decrease in that contractility, thus it causes dilation. So thus this is causing as a vasodilation. Okay, so this is normally produced in the body, and this drug or these nitrates are there many times. Because of the atherosclerosis, sufficient amount of nitric oxide is not formed, and therefore that is a problem. This is found to be most effective, most useful in the angina treatment. Now, what are various agents which are there in practice or therapeutically used? There are three important. The first one is called as a nitroglycerin or glyceryl trinitrate. The problem with nitroglycerin or glyceryl trinitrate is it is also a very what we can say strong explosive. So it was having a problems in formulation also, but still if it is done in proper formulation, still it can be done. Still it is there. The other analogs are there, that is isosorbide dinitrate and isosorbide 5 mononitrate. These are the other organic nitrates. There are also inorganic nitrate also. If you remember, during blood pressure or hypertension, we have seen sodium nitroprusside, which is inorganic nitrate. Okay, but this cannot be used. Sodium nitroprusside cannot be used for long term, and these three are most useful, most important in angina treatment. So these are various formulation tablets. It is available as a sublingual tablet, it is available as a capsule, It can be given by oral route, it can be given by a disc or subcutaneous type of this one, and intravenous is there, and this disc will be working for around 12 to 16 days. Okay, so these are ointments are also there. So there are a variety of forms are available about nitroglycerin. Similarly, isosorbate nitrate is there, and it is available in various dosages and can be given by ointment form or sublingual form, capsule, etc. So these are the various three important nitrate which are important. They are working. Now what are the effect they are having? They are causing the vasodilation, particularly venous vasodilation is more, and this because of that venous pooling is there. Because of venous pooling, less blood will be going to the heart. Because of that, what will be reducing is the preload will be reducing. Because of the decrease in the preload, there will be decrease in the stretch on the heart. Because of the decrease in the stretch on the heart, the contraction will not be as forceful it will be, and thus it will be working at many times, many places accordingly. So why they are effective? Because they are reducing the oxygen demand of myocardium is most importantly. This drug is reducing the triple product, that is what we call it as a aortic pressure multiplied by heart rate multiplied by ejection time is one of the important parameter. So it will be working on this. Then second thing is, as I told you, it causes reduction in the myocardial oxygen requirement. How it causes? I told you that it acts on the blood vessels, that is venous pooling, and because of that what it makes is the decrease in the venous return. Decrease in the venous return will cause decrease in the preload. Because of the decrease in the preload, okay, the diastolic pressure that causes distension of ventricle or stretch. Frank Starling yesterday, those who have studied it. So because of that, that stretch will be decreased. Because of that, the contraction will not be forceful. If the contraction is more forceful, then the demand is more, because heart has to work more. Demand is less forceful, then it will be there. So first thing is it is, and second, because of the decrease in the preload, because of the higher preload, or that is the filling of heart, that is ventricle filling. So if the more blood is there in the ventricles, then it will causing more stretch, and because of that compression of the muscles and compression of blood vessels, so that also decreases the activities. So this will also cause decrease in all the activities. The nitro-vasodilators, they decrease the preload by, as I told you, venous return. They also affect the afterload because they act on various arteries. So if the arteries are dilated, then it causes decrease in the afterload. Okay. So they are working what? They are causing many things. They are causing the increasing venous capacitance. So that causes decrease in the venous return. Because of that, decreases the ventricular end diastolic volume. So because of that, less stress. Because of that, less oxygen consumption. Then further is it reduces preload. Therefore, what we can say, less powerful contraction. Again, it causes decrease in the demand, decrease in the workload. Then it is working on the arteries. So dilation of arteries, including coronary artery, causes this coronary artery dilatation is causing increase in supply. Further, there is because of the vasodilations, then it is causing what? Decrease in the afterload. Because of the afterload is there, the force or powerful contraction will not be required, and this will cause still better activity. And thus these are because of the several role it is causing. So this is how the drug is acting, and because of this the effects are there, and it is one of the best medicine. As I told you, almost 140 years are there, but still the drug is found to be the best one. Okay, there is almost no other better replacement to this. After certain period of time, the tolerance can be developed, and accordingly in that cases some other drug has to be used. There are variety of reason why the tolerance is developed, and because of this tolerance, okay, this for that one has to modify or change it, the drug frequently. Okay, so the high doses should be avoided as far as possible, because if the doses are high, then the tolerance will be more, and slowly there can be change between their the drugs, like glycerol trinitrate to isosorbide dinitrate, like that it can be there, and accordingly it can be there. Toxicity that way is quite safe, but all of these action, the adverse effects are because of their action on the cardiovascular system. Example is headache. Headache will be there because less blood supply will go to heart. It can cause postural hypotension, as we have seen other times also. Okay, and these are a variety of activities which are there. All this dizziness, weakness, they are all because of the postural hypotension which will be there. Okay, so these are the important problem which are there. Nitrates can also having action with the phosphodiesterase 5 inhibitors. Example which are used for the erectile dysfunction, that is sildenafil, tadalafil, then vardenafil, etc. These are all the drugs which are actually sildenafil was the drug which was basically thought as an anti-anginal, but later it was found because there are a variety of phosphodiesterases are there. So this phosphodiesterase 5 is particularly more in the pelvic area in the person, that is penile area, and therefore this drug is known as, it has been used instead of angina, it is used in that. So they are very good agents. They are used for angina pectoris. Short acting nitrates can also use as a, that is glycerol trinitrate for standby therapy. Longer acting nitrates for the prophylaxis of angina were already been proven. They are useful in the variant or plainsmental angina. They are part of the congestive heart failure. They are used in the unstable or acute coronary syndromes. In that cases they are used. The other category of drug is calcium channel blockers. We have seen them earlier. There are three important basic chemical classes, that is phenylalkylamines, then benzothiazepines and dihydropyridine. We have seen earlier that what are the effects if we have 1 to 5 range. Then verapamil causes vasodilation up to 4, while diltiazem causes comparatively lesser, and dihydropyridines like amlodipine, telodipine, then nifedipine, etc. All these are having highest vasodilation because they are acting more on the blood vessel comparatively. They are more selective. While contractility, while verapamil is having higher effect on the heart, and therefore it causes much decrease in the contractility, verapamil, while diltiazem is having comparatively lesser it, and the amlodipine, etc., they are almost very little effect on the decrease in the cardiac contractility. Then next is decrease in the automaticity, that is decrease in the firing from the SA node, or that will be heart rate. So the heart rate will be reduced more in the verapamil, in diltiazem, and again very little effect will be there from the dihydropyridine. Now this is again homework. If you want, you can go through. I have told you the reflex actions. What will be the reflex action? If the amlodipine is acting more on the blood vessel, it can that way cause increase in the heart rate. So that way directly it is causing decrease in the heart rate because of the decrease in the automaticity. But at the same time, because of the vasodilation, it causes stimulation of cardiac center. We have seen it earlier, but I am reminding you that this is how you should study. Okay, this is what physiology is there. Then decrease in the cardiac contractility, decrease in the automaticity, and lastly is the decrease in the conduction from the AV node. So this is all variety of effects which are having. If you remember, chronotropic effect, then inotropic effect and dromotropic effect. These three effects we have seen earlier in earlier slides or during hypertension. So these are the effects these drugs are having, and accordingly these drugs are being used. Okay, so these are one of the important choice in the angina pectoris also. We have seen how they are acting earlier, that they causes the decrease in the calcium into the cytoplasm. Because of that, calcium which was required for various purposes. What are the purposes? Calcium causes one thing, calcium is required in the contraction of either smooth muscle or skeletal muscle or cardiac muscle. In all cases, calcium is required for contraction. Second thing is, calcium is a divalent ion. Because of that, it is a positive charged ion, and it can cause the changes in the electrical conduction in the heart. Okay, so this is another impact the calcium can have. And because of all this mechanism, this calcium which is present over there, that shows various effects. And if we can block this calcium, we can reduce the calcium. The less calcium will be there. Because of that, there will be this kind of effects. As I told you, these are called as L type of voltage gate channel voltage gate channels. And the selectivity, although they are all L type of voltage gated channels, ion channels are there, but the selectivity of various drugs, example, verapamil is more cardioselective and nifedipine is more vasculoselective. So it will be having more effect on the vessels. So this kind of selectivity will be there, and accordingly it will be there. Okay, so we know what are the effects. First is vascular tissue. So we have seen the effect in hypertension, that it causes, because of this effect, it causes decrease in the calcium. Because of the decrease in the calcium, it causes there is a vasodilation. Because of vasodilation, the next thing it causes is decrease in the blood pressure. We have seen the effect now, impact of blood pressure. If the blood pressure is decreased or arteries are dilated, that means it causes decrease in the afterload. Okay, and that is indirect benefit it is having. Okay, same thing if it is happening to venous, then again it causes decrease in the venous return. That simple chart which we have shown earlier about demand supply, that will help you to understand mechanisms also. That simple, if you can remember, then you have to just extrapolate this with the logical explanation. Cardiac cell, already we have seen that it causes decrease in the heart rate and decrease in the force of contraction, because calcium is required for contraction also, and calcium plays a role in the conduction of impulses also. So this is very important, it is doing, and therefore they are important, or they are useful in that. So all these effects are there, and because of that, the various effects are seen. We can see the effects. What will be the effects if you use a table? So these are the dihydropyridine. Example of dihydropyridine are all the dipines, nifedipine or amlodipine, etc. So what they are causing? They are acting. They are you know about that. They are more specific toward vascular one. So what it will cause? That will cause vasodilation. Therefore, it will decrease the afterload. Because of that, it will cause the sympathetic nervous system activation. Okay, because this is indirect. Okay, this can increase the cardiac output. Okay, then it has got negative inotropic effect, negative chronotropic effect, and thus it will cause decrease in the. This is reflex action, mind well. Okay, but this can be blocked. Then what will happen with the verapamil diltiazem? They can cause again vasodilation, they can cause afterload reduction, they can also cause decrease or inhibition of this activation. Okay, this is negative, means inhibition, and the cardiac, and therefore the cardiac output heart rate here it is showing increase because of this sympathetic nervous system activation. Okay, here it is not sure, either it can be increase or decrease. So this is how the role of cardiovascular center plays important role. Okay, then next is where these are used, what are the therapeutic uses of these. They are in various kind of angina, we can use them. Okay, then in exertional angina, that is unstable angina we can call it, so we can use them into it. Okay, then in variety of anginas we can use it. Only verapamil and diltiazem we shall see them as anti-arrhythmic also, because they are more acting on the heart. They are not useful in arrhythmia. They are more useful in the arrhythmias. Okay, beta blocker already we have studied. What are various kind of beta blockers and how they are helpful. Okay. Then there are other drugs which we shall see in our next class, that is various antiplatelet agents, then anti-integrates, anti-thrombolytic agents. Now this drug as such we shall be studying, and okay, I think maybe atherosclerosis we shall be studying them, or in the thrombolytic agents. So at that time you just remind me. Basically these are, before that you read the topic of what is known as a coagulation, how it is taking place, what is thrombosis, and how we can use the this, how we can block this. So this will help you in understanding this. Some of these things we shall study during study of prostaglandin also. So there we shall have one more look about it. Okay. Then next type of drugs, they are called as a anti-anginal drugs. I think we can finish over here only. So these are very typical drugs. They are called as a anti-anginal drug. Example of these are trimetazidine, ranolazine, etc. The mechanism is not exactly clear how the ranolazine is acting, but it is anti-ischemic and it is anti-anginal effects. They are independently of the reduction in the heart rate or arterial blood pressure or changes in the coronary blood flow. Actually they do a very different way. Means as we have seen earlier, very classical one is either the drug should decrease the demand or they should increase the supply, but they are working in different way. They are having a typical another class. So while classification, you can make the classification the drug which are decreasing demand, the drug which are increasing supply, and this is a third class. To that we call them as anti-ischemic agents or anti-anginal agents only. Anti-ischemic normally they are called as. So these are the agents. They are acting on various cardiac ion activities, and the sodium channels are there, that is inactive sodium gate we call it. So these are contribute to arrhythmias in the patient with the long QT3 syndrome. We shall see this in arrhythmias, and it is also increase in the heart failure and ischemia. Reduction of this late sodium inward current, I sodium is written over here. So this I sodium is sodium late sodium inward current. This you will understand when you will understand the various events in the electrical or electrophysiological situation of the heart. So in that you will understand it in more way. What do you mean by sodium inward current, and what it is there, how it is important in the cardiac functioning. Okay. So this is leading to higher diastolic calcium concentration, and it causes calcium overload. We know what are the role of calcium. Now because of this sodium, if the calcium is building into the cytoplasm, then it is a problem. Okay. So this calcium which is built, we know it can cause many activities. It can cause the impulse generation, it help into that. It helps into, second thing is contraction. So it force of contraction and everything is increasing, then definitely demand is increasing. Okay, so this will be doing accordingly, and it causes the detrimental or damaging effects on the myocardial ATP hydrolysis and cardiac function. One more mechanism has been proposed. Proposed, see, word when we use proposed, that means it has not yet been confirmed. Various scientists are thinking or it and planning it. Ranolizine reduces the cardiac fatty acid oxidation and it stimulates the glucose metabolism without inhibiting the carnitine palmitoyl transperases 1, and this is particularly initially it was categorized as a metabolic modulator. That, see, normal metabolism, heart is doing beta oxidation of fats, okay, but when there is a ischemia, then everything goes difficult, and this process, although is high yielding, but it makes a problem. Again, you go for biochemistry reading for year, how the heart is utilizing energy, and it shifts. The ranolizing helps in this decrease in the fatty acid oxidation, which can be damaging, and here it causes using glucose as a metabolic modulator, and this is important. Okay, so this is one more proposed mechanism of this. Then another drug which is there is a nicorandil. Nicorandil you have seen in hypertension also. It is a nitrate ester of nicotinamide. It was developed as an anti-anginal drug, and it is acting on the potassium channels. It is a potassium channel opener. Okay, so it opens the potassium channel. You know, if potassium channel is open, what will happen? Potassium will come out and the membrane will become more negative. If membrane become more negative, it will automatically decrease the heart rate, and it will decrease the or it will require more sodium to go inside. So more sodium has to go inside to make the threshold potential, and for that, making more threshold potential, that will cause then only the calcium can come in. So thus it will make impact. It will reduce the heart rate. It will reduce the force of contraction because of the potassium. It causes dilatation of arterial and blood vessels, and leading to decrease in the afterload and preload. So there are variety of action the nicorandil is having. ADME you can read through. Then another drug is trimetazidine, which is also known as anti-ischemic or anti-anginal drug, and it is thought to be acting through the decrease in the beta oxidation and improving the glucose metabolism. So these are various activities. Therapeutic strategy you will study during what we say your therapeutics. So what are various drugs, what you can do, and what are various managements. Okay, so these are various treatments. These are the tables which should help you to understand various drugs and their utility, their typical things about angina. So you can see how many drugs are there. All these drugs, like 3 organic nitrate. One is molcidomine, which is a nitrate donor. It donates the nitrate, and this is also used in angina. It is a second choice after nitrates. Adverse effects are same as the nitrates, and there are no documented advantages over this GTN, that is glyceryl trinitrate or isosorbate dinitrate or isosorbate mononitrate. So normally they are very cost effective, the above 3 are. So they are molcidomine is less considered. Inhaled nitric oxide can be there, and it can be directly put into near lungs, and it immediately absorb, but it is in hospitalized only. So many calcium channel blockers are there: amlodipine, felodipine, licardipine, nifedipine, nitrendipine, etc. And other are calcium channel diltiazem, verapamil, but they are little use. Okay, only in case simultaneously arrhythmias are there, then they can be used. There are so many beta blocker are there. Ranolazine, ivabradine is again one of the drug which causes decrease in the heart rate by inhibition of this hydrocyanide currents in the SA nodes. Okay, and this is a second choice in the prevention of exertional angina. It is approved in the patient which are not tolerating beta blockers or having heart rate less more than 75. So in that it is used. It is used in two conditions: heart failure and angina, and nicorandil. So these are all various drugs. Lastly, trimetazidine, antiplatelet, and all we shall see later. So these are the drugs which are categorized under anti-anginal. The important thing what you should remember is this, that is the drugs basically are acting in three basic mechanism. One is which decreases the demand, or which increases the supply, or which modulate the metabolic activities. Okay, and this is how we have finished anti-anginal drug. So what's your next topic you would like to study? Please go through it, let me know it, put it on WhatsApp group that you want to study this topic, so that it will be easy for me